Hello, I'm Dr. Van Merkel, Doctor of Chiropractic. I'm board certified in clinical nutrition, and I've got a couple other certifications. And I've been in practice in Dayton, Ohio, as you can see, for over 37 years. Been host of a radio show for over 27 years. I'm the inventor of a patented medical, nutritional, analytical diagnostic software. Founder and president of Science-Based Nutrition, and you can read the other things there. But I hope to show you today some of the things that's possible that maybe will give you doctors a little encouragement that maybe there are more things you can do to help your patients. And for people out there, patients with health problems, maybe this will give you some encouragement, maybe some hope that there are things that you can do to improve your health. So I'm just going to show you some cases here, some things that hopefully will give you a vision of what is possible. Some of these are from cases from many years ago because I've been doing this a long time, but also some of these are from current patients as well as patients from the doctors that we consult with. And I'm just going to go through these in a little bit of detail, and this one is so exciting. And some of these doctors who wrote me these letters or emails have provided some information about their clinic. And this is Dr. Dan Miller. You can go to fortwaynechiro.com and read about his case, but here it is. He says, and I quote, I'll just read this: "Your science-based nutrition program saved my life and my practice." And you can go to his video, to his website, and see his video. "My chronic pain story: became a chiropractor in 2005 due to adjusting and having taken antibiotics for minor acne for 15 straight years, which tore down my gut. My body could not heal. My SC joints were surgically removed in 2009. I suffered a severe whiplash injury in 2008, which led to 7 years of pain meds, Oxycontin, Percocet, Cymbalta, Valium, Neurontin, etc., all at the same time. Wow. 18 neck injections. Visits to Cleveland Clinic, 9 neck MRIs, failed NK surgery. I was questioning life. I'm a born-again Christian, but this really tested my faith, to say the least. Finally, in 2015, I received an SBN flyer, science-based nutrition flyer. Didn't think it would help. I attended one of your seminars in Chicago, half alive, taking many, many meds. And he did the testing we recommended, and after the initial report, he followed the protocols that were established in the written report. That's part of science-based nutrition. And I quote, look at this: "I was 100% pain-free in just 2 weeks. After years having his pain on all those problems, in 2 weeks, on the right nutrients, the right vitamins, the right diet, 100% pain-free. So within 6 months, I was able to completely get off all my pain meds. And today, I'm 100% medication-free. I've taken many patients through SBN reporting, but my case is truly a miracle. MD after MD told me I would struggle with chronic pain for the rest of my life. I said no to that, and through much prayer in your program, my life has forever been changed." And there's a verse he has there. It says, "Thank you, thank you, thank you for being a pioneer. I believe you literally saved my life." And that's exciting. I can't wait till you doctors get cases like this. Or maybe you have problems, and people out there, if you're on drugs, if you're on pain meds, if you're on heroin or other strong painkillers, maybe there's a solution, a natural, safe solution for you. I'm just going to go through some cases here to give you a vision of what we do. Stage 4 kidney cancer. And I said, this is a great guy. In January of 2019. No, this is a female. Presented to MD with chronic cough. Lung cancer was found to have metastasized from her kidneys. I'm thinking about another patient 5 years ago at clinic who had stage 4 kidney cancer. That might come up here a little bit later. But anyway, stage 4 cancer, was given approximately 6 months to live. PET scans were positive, most in the lungs. Too late for surgery or radiation. Chemo was recommended, but declined. Since it wasn't going to extend her life, she declined it. Other drugs recommended, but they were also declined as they had very serious side effects. And the patient figured she would feel worse for the time she has left. If you only got 6 months, why do you want to feel bad longer or for the time you have left? So she came to me, And we did some testing, and I'm not saying we're going to cure her cancer, but can we get her healthier? Can we get her feeling better? And now we are, as of April, where actually this is now May 14th. She still feels fine with no symptoms except a mild cough, which is even better. And I'm doing this May 14th, 2019. But look at some of her numbers. And her numbers on 213, LDH, lactate dehydrogenase, indicates tissue breakdown, which is commonly elevated in cancer. Ferritin is high. It's an inflammatory acute phase reactant. In CRP, these can all indicate tissue breakdown and are commonly seen elevated with cancers. So with her stage 4 cancer, and there is no tumor marker for this type of kidney cancer that she has that has metastasized to her lungs. Her LDH was at 315, and in 1 month it dropped down to 254. Nice improvement. Her ferritin dropped from 498 all the way down to 195. And CRP, look at this. This is commonly elevated in kidney cancer. Went from 48 all the way down to 1.7 in 1 month. Look what happened just a couple weeks after that. Things have continued to drop even more. This is a good sign that her cancer is less angry, less invasive, that her body may be getting healthier and reducing the acceleration or speed of the cancer, and maybe it'll go into remission. Not saying she's cured, and I don't have a cure for cancer. I don't have a cure for cancer. But we have had people go into remission where the cancer is now not growing, not getting bigger, not invading, and we have some patients been away for many years. Let's move on to the next one. Helped a baby girl, 1 month old. And this doctor writes this: I feel in my heart that a prenatal nutrition protocol had so much to do with what we're seeing now. We'll be monitoring her cognitive development as well, but she is bright as a button, engaged in her environment, and just being a very vigorous baby girl. Who knows how nutrition influenced her intrauterine development? I am so grateful and so thankful for both you and your support during my daughter-in-law's pregnancy. And God bless you both. In science-based nutrition, I know in my heart that this greatly influenced this positive outcome. Now, there is more to this story, but that's all the doctor felt comfortable sending. And how about this? In just 2 months, this is one of our SBN members. This is one of our SBN members who's got some great cases, and this is one of them. And after just 2 months of following the science-based nutrition program, the doctor no longer wants to do a liver transplant. Wow. And his quality of life has increased significantly, and he had a good Thanksgiving. He was losing weight now. He is gaining, so MD is happy about that. That's very exciting. Multiple sclerosis, diagnosed 15 years ago. This was in, the patient wrote me in February 2011. And to date, I need to update this date here. Patient is still on fall meds and doing very well. But when she started with us, she stopped all of her MS medications, you know what drugs they are, that she had been on for many years, and plans to stop and to try for a month, with the neurologist reluctantly agreeing to that. Now here she is, 15 years later, 16 years later, 17 years later, not on any medication. That is very exciting. So again, you get healthy enough. If you get healthy enough, does it really matter the name of the disease? 27 years of Zoloft, now off in a few weeks. This is one of our SBN members, and this doctor said, this one is about me. 27 years of Zoloft for anxiety and other psycho problems I've had are a thing of the past. Been doing SBN for about 6.5 weeks and been off Zoloft for about 4 weeks. I've never been able to come off the meds for over 3 to 4 days without horrible problems and instantly have to resume. Yes, you may share that praise report because it is huge and so many people have the same issue. Wow. It's what we're here for, to help people get well and anxiety, stress, whatever, psycho problems, as he says, thing of the past. And here's another SBN member. Just want to thank you for what you are doing. Last year I got tested. My iron was, his ferritin was 706. I was just tested yesterday. My level is 63. Liver enzymes are also down. What can I say except thanks for saving me? Once again, you had life-saving, changing effect on someone. And this doctor told me that many of the males in his family have all died young. Well, they didn't make it to 80 or 90. They all died young from various things. And he believes maybe this high ferritin was the underlying factor that drove heart disease, cancers, strokes, all these different things, which it can if you read and understand hemochromatosis and effect of ferritin, high ferritin on the body. And his was very high. Traumatic brain injury. I feel like $1 million. I have a history of traumatic brain injury. My symptoms have been getting progressively worse over the last few years. And after we figured out what was going on, hemochromatosis, the traumatic brain injury was from hemochromatosis. And so once we dealt with that, and I'm able to, and I'm working to heal my damaged organs, I feel like $1 million. I'm able to work almost twice the amount of hours I was before. I no longer have daily headaches, and I can now have a glass of wine without feeling like crap. Everyone in my life has noticed the difference, and honestly, this has been life-changing for me. And think how many doctors out there are having health problems, as well as people, and they don't know what to do. So I always tell doctors, start with yourself first. Take care of your health problems. Kidney failure. And in just 3 weeks, a patient waiting on imminent dialysis because the kidney failure was found at end stage, which that's generally when it's found. That's why you all need a blood test every year. Just quickly, you only need 20% kidney and 20% liver function to be relatively symptom-free. So by the time you have symptoms of kidney disease, you're in kidney failure like this construction worker was. But in just 3 weeks, he had 4% improvement, and he was no longer looking at imminent dialysis. Very good. Here's a detox program. You can read about that. One of our doctors was treating a patient. The patient went to another doctor that does detoxes and went on a program. And while on this supposedly healthy detox program, the liver enzymes dramatically increased, and it was shutting the thyroid down too. But the liver enzymes jumped dramatically after being on these cleanses and flushes you've all heard about, which we do not recommend. A gentleman with low testosterone. Now, this is Dr. Andrew DYER, one of our team members at my clinic in Dayton, Ohio, Take Two Healthcare. And a 68-year-old man came in with low testosterone. Medical doctor measured testosterone at 158. And after visiting Take Two Healthcare, he was placed on a special plan. And after only 2 weeks, his testosterone nearly doubled to 301 in 2 weeks. Wow. 480 being the goal. Update. In 7 months, his total testosterone went from 158 to 501. No DHEA, no hormones, nothing like that. Just good natural programs, which science-based nutrition or directs testing and provides a report which explains what's going on and tells you pretty much exactly what you need to do. And during this time, not one occurrence of a cold sore, which used to occur approximately monthly, no cold, flu, or any illness. His sleep quality, duration have improved, increased libido, obviously. Stamina and performance, recently set a personal best during a rowing workout. Nails, hair, and beard are also growing faster. Very good stuff. Thank you for changing my life. Again, another chronic pain story. Benefits of proper supplement program. This is Dr. Natalie Yaley, another one of our team members here at Take Two Healthcare. And this lady had complaints of depression, highly stressed out, night sweats for many years, was on Lexapro, etc. After getting a testing done, a comprehensive report analyzed, and we saw improvements in liver function, kidney function, thyroid function in just a few weeks. Her 3-week follow-up is as follows. Hot flashes are gone. Night sweats are gone. She's having normal bowel movements. Toenail fungus is gone. Lost weight. Headaches are gone, and gray hairs are darkening again. You don't need bioidentical hormones. You don't need DHEA, because those are all, if you have hormone problems, there's a deeper problem going on, a deficiency, imbalance, or toxicity. And so when you get those things corrected, hormones will take care of themselves. And here we have a 10-year-old female, not growing, not gaining weight, never hit the percentile, never hit her percentile since birth, and at 3 months old had projectile vomiting and refused to nurse. This patient had stomach ulcers, and after a few weeks, ulcers are healed. And the mother wanted to give Dr. Marcol an update on, actually it's one of our SBN members, one of our patients. And the mother came to the office with her child, and she had only gained 2 pounds over the last 2 years since getting tested, taking nutritional supplements. This girl has gained 3 pounds in the last 2 weeks. That's good. We figured out what's going on. Blocked arteries are cleared. My left anterior descending coronary arteries, 90% blocked, is now 100% clear. Good news, we built a recent angiogram. And my cardiologist said, let me read it. All my heart arteries, including the bypass, are 100% clear. Cardiologist said he never seen or heard such an outcome in his practice. And yeah, arteries get cleared too when you get the body healthy. This is one of the doctors had a patient come in who, when they saw the report, were so excited. The patient said, I'll pay $3 up front to get tested, because he saw the comprehensive nature of the testing and how thorough the report was. The doctor tried to put the patient off and say, I was going to test myself first, so I wouldn't be expecting others to do what I'm not doing myself. He said he didn't want to wait. People know how important blood work is, and that's why patients are looking for this type of thing, of bioidentical hormones. And maybe when you're reading through this, you can pause it here and read through this, but just look at some of the things. She's off progesterone cream and vaginal estriol, and since stopping them and being on our program, and just day 6, not waking up anxious, slept better, didn't feel sickly. Husband says he knows to use improve my mood, and I laugh a lot more. She feels as if I'd been poisoned by the bioidentical, and it's only been 10 days. So more information there you can read. Cancer marker dropped 10 points in 1 month. That's great. 10 points from 40 down to 30 in just 1 month without chemo, radiation, or drugs. It dropped. That's very nice. Post-polio syndrome. This guy had it for 25 years, which is like chronic fatigue times 10. And after, he would go months without getting out of the house, days without getting out of bed. Can you imagine? After 2.5 years, he's 50% better, not in bed all the time, out of the house at least every other day. He's called and told me several things. Thank you for saving my life. And here's another doctor who started testing. He said lifelong conditions, ailments are cured. Yes, I said it cured. Patient quality of life is vastly improved. Certain lives were saved as this doctor started doing SBN. 6-year-old female with extreme atopic dermatitis. This is another one of my patients. One of the worst I've seen. Every bit of her body was covered except the palms of her hands, soles of her feet. Even her arms and head, eyelids, lips were covered. Within 6 months, patient is much improved. After a few more weeks, the skin is no longer scaly, and skin cleared up completely in just 3.5 months in a 6-year-old girl. You can almost cry looking at this girl, but she improved very nicely in just a few weeks. Non-small cell carcinoma, given 3 months to live, 8 months on his SBN program. The scan showed no sign of cancer. Lymph nodes are clear. Oncologist said it's impossible. MD said it's miraculous. But look what the body can do. Rheumatoid arthritis, in less than 2 months. Patients off all those drugs in just 2 months. Diabetes, undiagnosed and out of control. In 4 months, A1C dropped from 13.7 down to 6.3. Glucose, 353 to 99. You can read more of that information. And you can see how the a type 1 diabetic, another patient, she was on 24 units a day, which is actually pretty good, but after being on the SBN program, she got that down to 12 units a day. Very nice improvement. Lost 90 pounds in 8 months. Again, you get the body healthy, do the right things, and weight will come off. 11-year-old girl, 4 shots of insulin down to no insulin in just 10 months. and she'd gone 3 months with no insulin, still doing well. Six-year-old girl avoids colostomy in another one of our patients here in our clinic. At 6 years of age, after multiple surgeries for a birth defect of the colon, a colostomy was recommended. And after 6 weeks on our SBN program, normal controlled bowels, and she's now about 14, maybe 15, and completely normal. Completely normal. But true, she was going to one of the best, well-known pediatric colorectal centers in the country, and the best they could offer was a colostomy. And this is pretty amazing. Think how that little girl's life has changed by just that, by coming to our clinic and getting straightened out. Her life is forever changed. I mean, this is incredible.